Hey, Virginia. All right, it is 4 o'clock on Thursday, almost through the week, and I know at this point in our battle against COVID, the weeks can be really long. What I'd ask is keep it up, keep wearing the mask. All the experts say it's working, not just in general, they say it's working here in Kentucky. So today I'm wearing the St. Francis School. This is in Goshen, Kentucky. They are virtual until September 28th, doing it right. Both of my kids were actually virtual today. Dad spent a little bit of time outside this office making sure it was going really well. And I understand that it's never going to be as good as being in person, but my daughter got up this morning. She dressed up. That's something as parents we maybe haven't done. But so excited to see friends, to see teachers, and we'll get back to in person. We want it to be safe, but let's remember that just because we're not as excited as parents about distance learning, our kids can still be getting a lot out of it. Let's start with the first four, or the fast four. At 4, we've got some good news today, and we want to have some good news as we go through these weeks. And the first piece of good news is jobs, and then the second piece is about infrastructure. So even with COVID-19 and significant short-term unemployment, we are seeing long-term investments in the Commonwealth that are going to create jobs long after this pandemic is over. It's a chance to emerge stronger from this, to make sure that when we're able to move out of COVID, we don't crawl, we don't walk, we run into our future. So we have 3 significant economic development projects to announce today. These projects, one in the eastern part of the state, one in the central part of the state, and one in the western, promise to create approximately 250 full-time jobs for Kentucky residents. Good jobs, too. So let's start with Claremont Distilling. First is some great news for Kentucky's signature bourbon industry. Kentuckian and well-known developer Lee Wilburn of Louisville's Crosspath Group plans to build a new distillery project in Bullock County called Claremont Distilling. The project has the potential for exciting additional development in the future. Today, Team Kentucky approved initial incentives for his distillery. That first phase includes a $13.4 million investment that promises to create 22 full-time jobs for Kentucky residents. These operations and management jobs are expected to pay an average hourly wage of $56, including benefits. It's important we continue to attract and create well-paying jobs for Kentuckians across the state. I want to thank Lee and his team for recognizing that paying good wages strengthens families and communities, and he is helping for us to build back in an even better way. It'll be located right off Interstate 65 at the Claremont Bardstown exit, spanning 15 acres along Kentucky 245 leading to Bardstown. Construction is scheduled to begin in the spring of 2021. Lee, exciting project. Thanks for creating good jobs. I'm sure it's going to be an amazing bourbon, and I look forward to trying it out when it's ready. All right, HVAC distributing. In Graves County, we have an expansion of an existing company and a major employer for the Western Kentucky region. HVAC Distributing LLC is expanding with a $7 million investment that will create 175 full-time jobs right there in Western Kentucky in the coming years. And let me tell you how important that is. I mean, I remember visiting Dawson Springs the last time that I was out, a place that I love very much. And I remember being struck when somebody came and said, just give us one new factory. That's just what 175 jobs can mean to a community. Now, Dawson is not in Graves County, but understand that in places that we have not seen enough jobs recently, 175 new jobs over the coming year can be transformational. The company is adding a second facility in the Hickory Industrial Park with the purchase of a spec building that will serve as a warehousing operation. The added space will help the company meet growing demand for its distribution of heating, ventilation, and air conditioning products for well-known brands such as Mr. Cool and GeoCool, just to name a couple. The company was originally established to support its sister company, Ingram's Water and Air Equipment, also in Hickory, and has expanded and diversified its business over recent years. We welcome this new HVAC distributing location, HVAC, as the latest in a key industry in Kentucky. Currently, Kentucky has more than 540 distribution and logistics facilities in the state, an industry that employs nearly 75,000 Kentuckians and has become more important than ever during this pandemic. Next one is one that I know Rocky was involved in. Rocky, give me a pronunciation. Dinelli. Next is to congratulate the Dinelli Corporation, which plans to open a 61-job facility in Ashland. Ashland and this area has been hit hard. We've seen closings of a number of plants. And this, actually in one of those former plants, is an exciting new opportunity that shows that there is not just hope, but there is a future reality with new and good jobs. This company will repair, refurbish, and remanufacture steel mill equipment. The company plans to invest more than $12 million into the existing facility at the former AK Steel campus. You know, I know people driving past look at that AK Steel campus and it hurts. It really hurts in that region when you think about the number of jobs and what that loss meant. You know what? This is building it back a little bit. This isn't just offering hope. It's actually providing results. The operation is projected to open in late 2021, and this company is a great fit for Ashland and Northeast Kentucky, given the workforce expertise in the metals industry. Dinelli Group is based in Italy and operates multiple facilities globally, employing more than 10,000 people. We're getting a big-time company in Ashland, Kentucky. I look forward to celebrating the opening of this facility with company executives who I talked to. As they were touring the facility, I was remote, the way I'm trying to do everything right now in this age of COVID. But I'm very excited about their commitment to the region. I think they're going to be very successful. And what I told them is I hope these 61 new jobs are just the start, and I think there is that opportunity. So, in creating a bigger, brighter, better future, making sure that everybody can compete for these jobs, you have to have the critical infrastructure that's necessary. Now, we've been talking about broadband a lot, critical infrastructure necessary for education and for jobs in the future, but there are still needs when they come to water and wastewater. Those can be industrial or they can just be everybody's right. I believe God-given right to clean drinking water and a safe wastewater facility. So today we're announcing an exciting project that showcases the hard work of our local communities and will spur economic growth. After nearly 5 years of hard work today, the City of Auburn and Logan County Fiscal Court officially broke ground on the Auburn wastewater treatment plant expansion. The current facility has not been upgraded in roughly 30 years, and it's been a big limit on their potential economic growth. The project was funded by a $1.5 million Community Development Block Grant, CDBG, through the Department for Local Government. Upon completion, the capacity expansion will encourage greater economic growth, residential expansion, and industry development in the area. Creates better possibilities. It'll also better serve Champion Pet Foods, a great company, an important community partner who's invested millions of dollars and created approximately 200 jobs to date. Grants are not money given, they're earned. It means you don't just have an idea, you don't just have a plan, but you can deliver and create a better life for your citizens. It took a good idea and years of hard work to make this happen. At a time when we're trying to thoughtfully rebuild our communities while keeping people safe from COVID, I'm glad this project is underway. Thanks to everybody who made this project possible. You showed the tenacity of Team Kentucky, and we couldn't do it without you. All right, next up, testing. We have to keep it up. As you all may have seen, the CDC looks like they're going to walk back some of the guidance changes that they made just the other day, meaning everybody needs to be tested and tested regularly. If you're willing to do it, you should be willing to do it. I think I was tested just yesterday, and that's probably 7 or 8 times. I'm sure my nose would remember. It's so important. If we want to be able to do the things we want to do, we've got to identify who has COVID, who is asymptomatic, prevent its spread, And if we had the level of testing that we all dream about, now we have a heck of a lot more than many of us could have ever imagined at the beginning of this. But if we can continue to build our levels, then there is an opportunity to do more things and to do them safely. Let's go through a couple of our testing locations because they're not all being filled. And I know that there are folks out there who want to test, so we got to connect those that want it with some of the places that they can go through. So let's start at the Louisville locations. So U of L Health, not all of these are being filled up. We could have more certainly in the Bullitt County Center, but again, there is both a number on this and they've added a website. This allows you to sign up for an appointment on the website. The state is providing these tests. We are paying for the administration. Please, as a citizen, make sure that you are using them. Results should come back in about 48 hours. That's our agreement with the lab that's there. So if your other choice is a testing site that takes longer than that, use this one. Let's go to Norton. This is our partnership with Norton Healthcare. I think they're doing about 700 a day. This one is going really well, but again, we have some excess capacity. I want to thank Norton for not charging the state anything for administering the tests. It is a community service by them, and we were proud when other testing supplies were running out to be a part of this partnership. Stu Lexington. Okay, so Kroger Health is actually ending this week. So I believe it's ending today, but there is the other UK testing site that we do not have enough signups for right now. We have excess capacity at these locations. There are actually 2 locations. If you go online to choose from, at least one of the locations didn't really have all that many folks come yesterday or sign up. So we can and we should do more. And then Northern Kentucky, 2 locations, all drive-through, very easy. None of these cost you a thing. Free. We work really hard to get results back in 48 hours, so it's the cheapest because it's free, it's the fastest, and it means that you can know whether you have this virus, keep yourself and others around you safe. And then if you'll just go to the full testing slide, if you're not in one of these areas, and these are just high volume areas, is why we keep using those, there are locations all over Kentucky. Make sure that you go to them. Finally, on our first 4 or our fast 4, vote. Please vote. You can be requesting an absentee ballot right now. I think it's over 100,000 that have already been requested. If you're nervous about COVID, if you live in a house like I do with somebody with a pre-existing condition or you have one yourself, if you are around folks at work or relatives that you're helping out that could be susceptible, go online to govoteky.com and request your absentee ballot. This is the bedrock principle of democracy. And while some of the rhetoric right now and the elections is well, I will say is concerning, the vote, that's how you make your voice heard. You want a better country where hopefully we can all come together and not be so divided. Your chance is voting. If you think things are moving in a right or wrong direction, your chance to impact that is voting. If you believe that you haven't been heard, your opportunity is voting. If we think about core duties as citizens, this is certainly one of them. So please go vote. All right, want to move in to our report from today. It's again tracking about what we've seen the last several weeks. Today we're reporting 775 new cases of COVID-19. You ever think we'd be to the point where we'd say we're at a plateau, which we're not happy about, but it's better than the alternative? 775 new cases wouldn't sound abnormal. It means that we do have to push to have fewer cases, but it does show that we are doing a lot of testing. 775 new cases once we do the daily removal of duplicates so that our data is as accurate as I think anybody's out there. Our total cases are 45,978. Our positivity rate is below 5% today. That's good, 4.8%. What's not good is a trend we're continuing to see with kids. And I think I saw something online that there's still someone out there claiming that kids don't get the virus or transmit the virus easily. Here's what I'd tell you, 23% of today's positives are kids 18 and under, 23%. That's 130 kids. Have you ever had a kid that's gotten a test because they're worried that you have it? I went through that. The questions they ask you break your heart, and the trauma that they go through is real. It's a trend we have to pay attention to. 11 high school age kids in Warren County today. Some of them are 18, so I guess they could be college students too, but if they're high school students, 11 kids in one county alone. Again, I hope that contact tracing is going fast because that school system is open right now. And for those that think by reading this off I'm picking on them, I'm not. I want those kids to be safe. I hope when y'all hear this that you can jump on it as quickly as you can and make it as safe of an environment. But I think we had up to 25 yesterday, if I'm right, over 4 days. This would make about 36 kids between 6 and 18 just in one county over 4 or 5 days. I mean, it's a real concern, and my heart goes out to that county and what they are still dealing with. New cases by county, this will show it. Jefferson, 157. Christian, 67. Again, Christian County was hit at one point hard early. Significant number of cases today. Warren County, 58. Always in the top 3 or 4. Fayette County, 46. Knox County, 25. We'd seen that creeping up. Again, showing that you can have a small number of cases and it balloons really fast because that's how this virus works. And as much as we can argue with the rules and the rest, you can't argue with the virus. It spreads the way that it spreads, and it is aggressive. Madison County, 22. Scott County, 19. Greene, 16. It looks like the predictions on how the community spread was increasing were right from their local health department. Hardin, 16. Laurel, 16. Bell, Kenton, Pulaski, all 14. Oldham and Rowan, 11. This is Rowan's second day being up in that higher zone. Bullitt, Davis, Lewis, and Russell, all 10. Lewis, again, having a number of cases. Total Kentuckians hospitalized for COVID, 573. In the ICU, 154. Fighting for their life on a ventilator, 88. Let's make sure we think about those folks. Today we've lost 8 additional Kentuckians. Let's make sure that we light our homes up green. We ring our bells. There's an amazing woman who works down at the Secretary of State's office that walks in this rotunda every day, rings her bell 120 times, one for each county, making sure that she is paying homage to the loss that is out there everywhere. Let's make sure we continue to do the same. We've lost an 84-year-old man in Allen County, an 89-year-old woman in McCracken County, a 75-year-old man in Warren County, 84-year-old man in Barron County, 70-year-old man in Hardin County, a 90-year-old man in Lewis County, 74-year-old man in Madison County, and an 80-year-old woman in Greene County. Long-term care facilities, 43 new residents, 38 new staff, 2 new resident deaths that are up there, 3 new facilities with at least 1 case. K through 12 Kentucky schools. This is one we're going to give because people need this information, and today's hurts. 26 new students since yesterday tested positive that are associated with the school district. That doesn't mean that they are in school. That's important to note. That doesn't mean it's a school district that is in school. Actually, a whole lot of them are not. So I want to make sure I clarify that. And even though I've clarified, somebody will say that. But 26 new students, 3 new teachers, 22 new schools. So again, widespread, very difficult to contain. This is why we've asked for schools to wait until September 28th. We've got a positivity rate that's coming down. We continue to wear masks. I think we can see a decline in cases if we continue to push hard, and then if we make good decisions about the activities that we engage in. Colleges and universities, 11 new students, 1 new teacher, and 2 new Kentucky schools. And in that vein on schools, can you put up the most recent news from Mississippi? Let's remember that our goal was to not be first so as not to make mistakes. This article from the Clarion Ledger now says that there are 720 schools in Mississippi that are reporting coronavirus cases. That's 90% of all their schools that are in session. So let's make sure that we're watching what's going on in the country around us, and again, that we're ensuring that we're doing our very best for those kids. We got a recovery story today. It's pretty personal. We're all thrilled here in the Capitol that there has been a good recovery. So I'm going to ask my friend Rocky Atkins to come up and talk about his dad.
Well, thank you, Governor, and I appreciate the opportunity to bring the good news report today. I reported to you all in this rotunda about a week or so ago about my father who had contracted COVID-19. I'm happy to report today that after nearly 2 weeks in the hospital and 1 week at Cardinal Hill, I'm happy to report that yesterday he was able to return home, back to the left-hand fork, the middle fork. My son Brandon, who I want to report on as well, I reported that he had tested positive also. And my son Brandon caught the virus without question from my father. My son Brandon is doing great. He's not had side effects of any serious nature, stopped up head a little bit. As you can see, he's a pretty stout young man there, and I'm proud of both of those fellas. You can see my dad there and my son both, and so happy to have this good report. You remember that I mentioned that we need to check on our neighbors. I'm thoroughly convinced that not for my son, that my dad would have probably lost his life to this virus. You see, the reason my son caught the virus was because he had to carry my dad to the bed. He had to help him get up. He put his clothes on him for about a 24-hour period. He laced his shoes up for him. He helped him get in the truck to take him to the hospital. So you can see why he may have caught the virus. Not only did Brandon test positive, but he was the one that took my dad to the hospital at St. Clair Medical Center on August the 6th. But he was also the one that picked up my father yesterday, August the 26th, to return him home. It was a pretty good reunion. And one of the most beautiful sights I've seen is I may have troopers not abided by the speed limit exactly, trying to get to Cardinal Hill on time yesterday to watch my father come through the door of Cardinal Hill with my son behind him. It was a pretty happy time for all of us, to be very honest. I want to take this opportunity to thank all of the frontline workers across Kentucky. I want to thank all of the medical experts that Governor are on the front line every day. And when I say the medical profession, I'm talking about the people that fix the meals and keep the facility clean, from the nurses to the folks that do the rehab, all of those individuals that are a part of that. I want to say thank you for the effort that you put out for my father to help him return home as yesterday. And I want to thank the people of Kentucky. I guarantee you I received thousands of messages and different ways of communication offering their thoughts and prayers for my father and my family. And I want to tell the people of Kentucky I'm very, very appreciative of that. My dad was very blessed to be able to return home yesterday, even though he's still on oxygen, and I understand, Dr. Stack, that maybe 6 to 8 weeks of his lungs healing from this terrible virus, that potentially he may get off of that oxygen, and I think he will. But even as he returned home yesterday, folks, there's 910 people that's not returning home. 910 people that have lost their life to COVID-19. And I say that not to bring a cloud over how happy and how blessed we are to have my father back home. I say that to continue to bring the type of recognition to those individuals and those families, but to bring the recognition of just how serious this virus really is. And I would like to say, as that old coach and that old school teacher, to give you that locker room talk one more time. We're in this together. This is a team effort. This is not an effort to divide people across Kentucky. This is an effort where we've got to come together to defeat this virus. While we may get frustrated at times and disagree at times, it's still an effort that we've got to come together as Team Kentucky to defeat. So as I give that update and what I labeled this as the good news report, the governor mentioned 3 projects today to bring jobs, to help the economy. And one of those that he mentioned as an economic expansion was a project in Ashland, Kentucky. Man, where we've lost jobs and the economy's been hurt. And today we bring a good report not only about my father and that part of Kentucky, but we bring a good report for a company who are bringing new jobs and the opportunity to grow those jobs in the future. So, Governor, I appreciate this opportunity. We're in this together. Let's win this battle. And if my dad could stand up here today, he could give you one of the most motivational talks you've ever had in your life. He would bring the people of Kentucky in one locker room, like he has done so many times, from the locker room to the classroom, to say, let's be on this team together. Let's whip this virus, and let's stay as one team, Team Kentucky. Thank you, Governor.
All right, let's close out with a little more good news about people doing the right things out there, and then we'll move into questions. It's Thursday. I don't think anybody would be upset if we finish just a little early. Again, wearing a mask, wearing a facial covering, one of the most important things you can do. Again, if you are wanting to get back to different things, if you want to make sure we can continue to do things we're doing right now, this is absolutely critical. So, this is Dr. Paul Rosen, PhD, who again is showing us that you can smile behind a mask. You can see it in people's eyes, setting a great example for this kiddo, who I'm guessing is his son. And here's a little, go to the next one. I talked about my daughter dressing up. She dressed up a little bit different than this for her first day today, but look at that. You see that joy? Just because NTI is a little harder on us, distance learning, as parents, let's make sure that we don't rub off on that joy that's excited to see her friends. And I tell you what, if wearing a mask gets her and my kids and everybody else back in school that much sooner, let's all do it. All right, these are murals popping up all around Madison County. And Jalen, a preschool elementary art teacher in Louisville, is helping to make those happen. It's pretty exciting, and we like seeing that. And of course, everybody in those masks. And this is neat. When there are too many times that I have to read people's ages for the wrong reason, this one is for the right reason. This is the 102nd birthday to Marie White of Shelbyville, Kentucky. That's pretty neat. 102 years old, wearing that mask. So she's going to be here for 103, 4, 5, and set that record. Make sure that she can impart all the wisdom of those years to us. All right, we'll open it up for questions. We got semi-full house today. I started over there yesterday, so Nick?
Would you like to see the Kentucky Board of Education, I guess, make some recommendations like HSA? What would you hope that those would be? How could it impact the high school students?
So the question is on the news, and I just saw the news when everybody else did, of the Kentucky Board of Education meeting tomorrow to talk about sports. First, everybody take a breath. Now rumors and Facebook result in people calling and making threats to hardworking civil servants, whether it's at KDE or other places. Come on. If you're one of those people today that made one of those threats, go talk to your minister. We got to be better than that. There's going to be lots of rumors every day, everywhere during COVID-19. There are going to be changes we may have to make along the way during COVID-19. Let's not lose our minds in every piece of new news. My position has not changed. The Kentucky Board of Education, I think, came out and said that they're not going to hold tomorrow to make any decision on canceling sports. What would I like to see from the meeting? And let me be clear, I didn't ask for the meeting to be called. I didn't work with anybody to call the meeting whatsoever. But if this is going to be a parental choice, a superintendent choice, a principal choice, a coach choice, it's got to be based on real information. I mean, I see some waivers that are out there that say, I assume the risk of COVID-19. Well, do the parents signing those know the risks? And I hope everybody would say, well, let's at least know what's out there, and let's make sure we have it in an area where we can all hear it and we can all make that decision. So what I'd like to see is a meeting where they simply lay out all the information that's out there, so parents, teachers, coaches, superintendents all know what we're looking at. We are seeing at least a positive response right now when we know there are COVID cases in sports teams, and we've seen a bunch of them. I think 2 new ones from Somerset. I think the Marion County football team, Lawrence County football team. Previously, we saw the Hazard football team. There's a Louisville volleyball team. We're seeing a lot of volleyball. I think a discussion which did not occur at the previous meeting on different safety precautions is something that we all ought to be open to. But everybody take a breath. I don't think there's any change coming. I'm not the Board of Education, but Facebook spreading all these rumors and getting people riled up, and then acting in different ways towards folks that I think are just trying to do a good job. We ought to be a little bit better than that. Mm-hmm.
There are billboards, television spots running. Are you familiar with the mechanics of this effort, and is the state involved, and how's it going?
Yes, the question is on an effort that is currently underway. I pledged as governor to work to sign every single Kentuckian up for some form of healthcare coverage. I believe healthcare is a basic human right, and during COVID, we see how critical it is. We see what the expansion of Medicaid means because we have had fewer people die than many states per capita when, sadly, we're a little more unhealthy than most states. That's what having health care means. But we still have a lot of people in Kentucky that still don't have any form of coverage. And what we've seen during COVID is our African American, our Black and African American communities are dying at twice the rate they make up of the population. So in our effort to sign everybody up for health care coverage, we are prioritizing our Black, African American, and Hispanic communities, given the large number of cases that are there. The program is aimed at first getting someone on what we call the pandemic Medicaid, the easiest way to sign up, and then ensuring that we can get and keep those individuals on a form of health care coverage. But this is available for anybody and everybody out there. We're just trying to make sure in the two things. In the midst of a pandemic, we're reaching first those that are most at risk. But second, that we're responding to the fact that these communities haven't been a priority for far too long, and it's time that we start changing that. We will have, I don't think I have the sign up here, but we'll have that tomorrow. You have the website? Okay, so Secretary Freelander is here. You can go to our COVID website on resources on healthcare. It's our Benefind system that is out there that people sign up through. I believe it's a one-page application to get into the system, so it's never been easier. And Medicaid's worked, and expanded Medicaid has worked really well during this crisis in Kentucky. We oftentimes focus on what's not working well, and we get that. We got to do better. But this is a real success story in how healthcare has worked, both in our health systems, but also in our coverage. Morgan?
When will in-person appointments for people with unemployment staff or try to get their benefits worked out start back up?
So we don't have a set date for in-person appointments other than the one occurring in Frankfurt today. I don't think we have those next week, but we are getting closer and closer to being caught up enough to start opening those throughout the state. Our goal is more permanent long-term offices where we're not just moving around like we are right now, but we're trying to get those two-page letters out to the last remaining people. Sadly, we're down to the point where many of the remaining claims are going to be denials because under federal law, you don't get to give unemployment to everybody. There's set strict rules. And we want them to be able to get in the appeal process that we have to set up as quickly as we can. So we'll have an update on my hope. My hope is that our next update on that means that we're sending people out and they're staying out. But we are going to open permanent in-person unemployment offices just as soon as we can. Tom?
Speaking of jobs in Ashland, what is the latest status of Brady Industries? Has that got any chance of going forward, or because they can try to get its money back? Or
the question is on Brady Industries and what's the status? Well, there's been a leadership change. There have been at least some positive reports on investment in the plant. What I want to make sure, even with all the issues surrounding this project, and I think there certainly have been some, is that we first give it the opportunity to succeed. If there's a chance for it to succeed, everybody wants the jobs, even with the drama and the rest that has come with the project. But if the project's not going forward, I'm going to go get our money back.
The UK football team has met today. The last hour decided that they will not practice today in solidarity with all the other teams across other sports leagues protesting the shooting of Jacob Blake in Wisconsin. Your reaction to that, and also just to the more unrest we're seeing in Wisconsin?
So the question's on the UK football team meeting and not practicing today, just like the NBA did not play yesterday. I think there were some Major League Baseball teams that did not. Athletes, like all the rest of us, have a freedom of speech And what we are seeing right now is them using it for deeply held beliefs that I believe in many of the instances, if not all, are very personal. And those that believe that societal change is necessary, and I'm certainly one, doing what's within their power to try to move it forward. You know, we reacted the wrong way to some of these instances in the past. I hope people can recognize that this is the same right that many other people use in different ways, and you know, I think that it takes a lot of bravery to walk away from. You know, last night what we saw was a NBA playoff game when they could have forfeited for your team. That's putting a lot on the line, and it's probably a contractual issue too. It's also putting part of your livelihood on the line. And I think it's important that we listen and we try to hear the messages that are being provided.
I believe Dr. Stack is supposed to address that meeting. If he could come up and just give us some synopsis of what his message is going to be.
Tomorrow at the KBE meeting, Dr. Stack is going to be there to answer questions about the spread of the disease, and we all know that the virus spreads based on contact, and the longer and the more significant the contact, the easier it spreads. I think they just want to ask him questions about what we talked about up here the other day, which is there are real concerns, and I think everybody shares them, about the ability to succeed, to get a full season or even a partial season in high contact sports, as well as the potential risk to the student athlete, him or herself, myocarditis being something that's being seen out there. So I think that you'll see a more in-depth discussion of that. And as the commissioner for the Department for Public Health, answering those questions is his job.
Going to the CDC testing, the director still didn't definitively say that people who come into contact with COVID-19 patients should get tested. They said they may get tested.
Right.
What's your response to that? And I know obviously you want them to go a little bit further.
This is a question about the CDC guidance change. They're walking it back a little bit. But rarely does somebody make a change and then have to say, okay, we were wrong, and say it like that. It normally takes several steps that are back. That change in CDC guidance that they're pulling back was simply wrong. We need people who have been directly exposed, especially in high-risk situations, to somebody that has had COVID, to either, and potentially both, get tested or quarantine. Now, if what they were trying to say, which is what they weren't saying, is if you've been in that situation and you're going to quarantine for 14 days, okay, we'll take that too. But to suggest that you just go on with your daily life, not take steps to prevent the spread of COVID or determine if you have it, I mean, that's plain wrong with everything that we know about this virus. I don't know the motivations behind that change in CDC guidance, but it is not helpful. It is not in line with everything known about the virus. I don't know any in public health that agree with it, and I'm glad they're pulling it back. Listen, we all, for different reasons, may make a mistake, but this is an area where it's a life and death situation often, and so I'm glad that they're pulling it back. Stu?
Positivity rates stay, say, between 1% and 4%. Should it be safe to assume that on-campus instruction should continue?
The question is on universities, and the question is on the positivity rate of the testing. I think it's got to be a little more in depth of that. For instance, if your positivity rate is based on, I once saw there are this many people and this many tested positive, and therefore we have this positivity rate. Well, if not everybody was tested, that's not your positivity rate. Your positivity rate is amongst those being tested. And so if you want to establish a campus positivity rate, you not only have to test a significant number of that campus, but you got to keep doing it. And then you can't do a calculation based on something 2 weeks ago, right? We have a 7-day rolling average. So if you did a massive initial testing and it's 3 weeks later and you're saying, yes, but if you include the original testing, here's where our rate is, that doesn't work either, the way that the virus spreads. Then you got to look at your density of housing and how it could be spreading, where it's getting to. So I think our universities need to be really careful. Some recent tests that it's okay to say it's concerning, and we're watching it real carefully. Maureen?
Given a lot of calls that came in from people being upset by the idea of fall sports being potentially postponed or canceled, do you have a concern about the crowds if it does go on, if you do have, parents and all these sports fans wanting to go to high school games?
Yeah, I think the question is, am I concerned about, just tell me that part again. Crowds. Oh, well, I think as far as high school sports go, that there's going to be more information coming out from KHSAA about crowds, but it can't be normal. It can't be normal. And if there are any crowds, you got to be willing to kick somebody's parent out if they're not wearing a mask of a foot. So we got to think really carefully about that beforehand. One stadium that somebody puts a big group in, not following it, could end a football season. It's that simple. So I think you really got to look at the risk if you're going to do that. I think at least a lot of schools are looking at just parents. I know that there are other decisions being made out there. I just want to make sure that if these things are going to move forward, and high contact is with the virus is concerning, but if it's going to move forward, that decisions that we've seen people making continue to be made. You got a positive on the team, you postpone for the 2 weeks to make sure you get everybody better, even if it's your big rivalry game. And we need to see that same behavior, not just in the practice period, where it's not easy to do, but it's going to be a lot harder when there's more on the line. We just got to make sure that we see that type of positive behavior. And then we're seeing in different instances, not our sports teams, people arguing with the local health department about who should or who should not quarantine. You're getting a lot of kids together or groups. That's part of the deal. Right, you can't. You're not a member of the local health department. You can't. The thought that no, I don't think that everybody in this class should quarantine. I just think that these 4 should. That starts getting into the realm of ignoring public health while you're doing something that we don't believe is safe right now. Tom.
Tomorrow, even though it's not a hurricane anymore, Laura's going to be roaring across the state, and I was wondering if emergency management is geared up, but things along those lines.
So Laura is going to be the hurricane when we are, first of all, our thoughts go out to Louisiana, hit by the largest, most severe hurricane, I think, in 100 years. And we're still just now starting to see some of the impact. Believe it or not, I think it could have been worse than it's been, but I know that there is going to be some widespread devastation. It loses its intensity as it moves further inland. It is going to come through Kentucky. I think Friday night, Saturday, over the weekend. Emergency management has been giving me updates on it. Right now it looks like we're going to get rain. We're not going to get a huge amount, but emergency management is tracking it, and this is what they do. COVID has changed what our emergency management does. This is their traditional, what they do, and we'll be ready. The other thing I'd say is emergency management groups out in our communities across Kentucky, especially at responding to storms and flooding, are phenomenal. Before all this, we saw some of the worst flooding in southeastern Kentucky we'd seen, and we lost 1 life based on what was probably a poor decision, but one life, and the number of rescues are incredible. So I don't get a chance to talk about our emergency management folks the way that we used to with what we're fighting right now, but they do a great job, and we'll be ready for, it won't be a hurricane, we'll be ready for the remnants of Laura. All right, Lawrence.
No vote tomorrow on canceling sports, you say, all sports, but they could urge the KHSAA to reconsider some of its guidelines. Is that something that you would like to see, and what would you want that reconsideration to be?
The question again is on the Board of Education meeting tomorrow. You know, my position hadn't changed in that if we're going to beat this virus, we need responsible decisions made by superintendents and principals, coaches, and parents. In tomorrow's meeting, what would a couple things is just what are not the guidelines, but what are some requirements that ought to be there to keep people safe? And I know some guidelines have been out there, but we shouldn't be using locker rooms. If they're going to move forward, are we going to test our athletes in high contact sports if testing is available in the area? I think those are a lot of things that can be discussed. And my understanding is that there are a number of members of the Board of Education that are at least want parents to have information about health that wasn't presented at the Board of Control for KHSAA. But let me just say, we got a lot of independent, strong people on the Board of Education. That's the board I appointed, but once appointed, they operate as that board. And I think we got one new appointment that we're making either today or tomorrow.
But you directly or indirectly did not ask for this meeting?
I did not ask for the meeting of the Kentucky Board of Education at all.
I'm going to ask a similar question yesterday in regards to testing supplies. Is there really any change in where we're at with that? And where do you feel like that discussion fits in this whole discussion about testing in general?
So the question is on testing supplies. We are continuing to see shortages on many platforms, machines that are out there. Thankfully, as a state, we still have a good supply through most of our local testing facilities. Where we're going to start seeing, I think, the biggest hits will be our hospitals and some of our other commercial labs that we see out there, those that don't rely on the state system. And when you look at the overall testing that we have every week, there's a substantial portion that's out there. What I think it means is we can't let our guard down. I mean, remember the days where PPE was running out and we didn't have testing? That's still a very real possibility. And so if I can, let me work off that to end and get folks out of here and home. I will tell you, for me, this week has been hard. I'm tired just like everybody else is out there. I get frustrated just like everybody else does out there. There are times that I get mad. I have trouble not bringing all of this home, which isn't fair to my family. But you know what doesn't give a darn? Is this virus. Not one darn at all. And if I don't come and bring it every day, work through my frustration just like everybody else out there, then more people get it. Now, dealing with something like this isn't supposed to be easy, nor learning that. It is really hard. But these decisions still mean impacts on real families. You know, Rocky came up here and talked about his dad. That could have easily gone a different direction. So here's what I'm going to do. I'm going to make sure I get a decent amount of sleep this weekend. And I'm going to make sure that I exercise. I'm going to spend a little more time even tomorrow with my family. I'm going to do what's required to help lift up my mental health and my emotional health, because we're going to be battling this virus for a while. Now, I believe that we're going to get this vaccine or eventually a treatment that works really, really well, but we can't let it down, our guard down until then. And we can't continue to let these moments in our normal lives, like the beginning of summer, the traditional beginning of school, just let us say, to heck with it, we're just not doing this anymore. And it's the times that we do that we get frustrated and we get tired, that we see this virus taken off. We're all living for each other right now. We're all living for each other, because the odds that if I don't do the right thing, get the virus and spread it, that it'll harm me are low. But with those that I come into contact with, I could name 5 that would be in substantial harm or in the way of substantial harm. So we've been giving out numbers. We've been doing this for a while. The virus doesn't care if you or I are tired. So let's do what it takes to take care of ourselves, and we'll be back Monday at 4, refreshed, ready to go again and take it on. We'll have videos and press releases that are going to have the weeks and the weekends report. So we're going to get through this. We're going to get through it together. We're going to emerge with scars. We're going to emerge having lost people. We're going to emerge frustrated and ready to get out and do even more things. But if we do this right and we continue to live for each other, we're going to emerge with a whole lot of our family around us that wouldn't have otherwise been there. So we're going to end tonight with something very special. Today we're closing with a message from Virginia and I and my new friend Reese and his mom Shay. This is a message for the ASL community on the importance of wearing masks and where you can find clear masks. Parents of children who are deaf or hard of hearing can visit kyhandsandvoices.org/the clear mask for free while clear masks last. Well, it'll be up on the screen. Teachers, interpreters, employers, mental health counselors, or hospitals working directly with individuals who are deaf or hard of hearing can visit the website. But let me end by saying thank you to Virginia and Rachel who are here, not just for making sure everybody gets this information, but even in the midst of a pandemic when bad things are happening, they have seen real opportunities to help move this community forward, to provide more services than ever before. Every day, Virginia is pushing for those she serves. I couldn't think of a better partner to get through this with, and I couldn't think of a better advocate. So thank you, Virginia. Hey, everybody. This is Andy, and that great partner who's been with me every step of the way through COVID-19, Virginia. Over the past few months, Virginia has taught us the importance of making sure information is accessible to all. And she has truly stepped up to make sure all Kentuckians are included and everybody matters. Really, the entire country has taken notice of Virginia, and through her, the importance of ASL. At the start, masks seemed like a challenge to the ASL community. But, as they always do, the community rose above and overcame that challenge by creating clear masks to effectively communicate while staying safe. You see, Virginia and I stress the importance of masks daily at our press conference. But I'd like you to hear from my friend Reese and his mom Shay on the importance of these masks, from communicating to staying safe. Take it away, Reese.
Hi everyone, I'm Reese and this is my mom Shay. I'm 7 and I have hearing loss in both ears. Even though I have hearing aids, I still need to read lips. And I can't read the lips if your mask is covered up. So I need you to wear a clear mask so I can hear you better.
Hello, as Reese's mom, and like any other parent, my top priority is keeping my son safe. And part of a safe environment is him being able to communicate clearly with others. With his hearing loss, he depends greatly upon lip reading and being able to see the speaker's smile. These are vital tools in his success at school, which is why it's so important for teachers, staff, bus drivers, and even his peers to wear a clear mask. I encourage you to reach out to organizations like Kentucky Hands and Voices. They're made up of parents like me and families like us, and they are also providing resources for back to school, including obtaining a clear mask. Please help keep my son and others like him safe from COVID-19. Do your part and wear a mask, wash your hands, keep your distance, and be kind. Thank you.
Team Kentucky.
Please reach out to Kentucky's masks. If not for me, do it for Reese and his mom Shay. And Reese, I look forward to seeing you at the Capitol once we beat this virus. Everybody reach out, make sure you get your masks. Let's mask up Kentucky. Thank you.